antidepressants of all kinds, benzodiazepines, which are very dangerous and addictive, opiate narcotics for pain, oftentimes treating chronic physical pain that is perceived as physical pain, but it's actually unprocessed emotional pain that's manifesting physically, right? So we don't want to treat that with opiates as one example, because those people have a very high degree of likelihood of addiction and overdose ultimately. So looking at where we are, we're in an opioid epidemic, right? And today we're in the substance abuse rates, including opiates, in large part now mostly started by doctors, are on the rise across all domains in the recreational drug space. Opioid overdoses are higher than they've ever been. And we have higher rates of mental illness than we ever have had. And we have these, and that's after 30 to 50 years of having new biological approaches that we've been giving to everybody. So clearly something's not working, right? If everything's getting worse, right? We as the doctors, the researchers, we have to maybe take a look at ourselves and what we're doing and be like, okay, wait, is this working? If 50% of people are not getting better, is this working? If 70% of people are not getting better, is our basis for how we treat mental illness is off? And let's go back and reevaluate. So that's kind of where we are right now, is we're in the process of updating psychology and psychiatry with the latest neuroscience on understanding what the evidence really shows about how mental illness, what's at the root of it, which is usually, in almost all cases, processed trauma that's stored in the body. And it's the processing of that gets it out in all and helps people heal in all different kinds of ways.
And do you feel like people are drinking the Kool-Aid, like in terms of folks in the mental health space, in terms of, hey, we have been treating this from a biological perspective for years now, and as you mentioned, we're seeing numbers on the rise for multiple reasons. But I'm wondering, are you on an island? Do you feel like you're riding this wave solo?
No, definitely not. I mean, I think we're starting to see the entire field start to recognize, which is as evidenced by conferences like A4M that are bringing diverse populations of providers together, eudaimonia, these other events where clinicians are showing up to learn new ways of thinking about how to treat people better, our patients better. I think that we're starting to see an evolution happen where people are also seeing the same thing that I saw 15 years ago, looking at what was published at that time and what we were seeing in our patients. And I think that people are coming around. I think what's interesting also is that we started out in mostly a psychotherapy, psychoanalytic approach. Very few drugs were available at that time, back in the early 20th century. Then in the mid 20th century, we transitioned, or the second half, we transitioned into an almost entirely biological approach and eliminated almost all psychoanalysis and psychotherapy from the practice of psychiatry. And now, thanks to technology and psychedelic assisted medicine discoveries, we're actually going back to therapy combined with drugs, right? So we're starting to see that the error of our ways was thinking that it could all be done by therapy or all be done by drugs. The actual best outcomes are achieved when the right psychoactive drug is paired with the right kind of therapy. And that's where we see these radical, transformative, antibiotic level effects of treatment protocols that we're doing, which is what the original promise was. So it's actually very exciting where we are now and where we're going, which is cures to mental illness. But we had to come back full circle to get there.
I'm excited to talk about Apollo in a bit here, but I'd be remiss, like with someone with your credentials, that we don't talk about the whole, like as you mentioned, the psychedelic and the types of therapy that are coming of age that we're hearing more about. I got a colleague of mine that recently opened up a ketamine clinic. I know a friend that I met at a conference that's doing a psychedelic retreat. And so from your perspective, and it's a broad question, so I apologize ahead of time.